It is alarming to face a heart attack alone. An American experiences a heart attack every 40 seconds. This is a serious threat, but many people survive these events each year. A heart attack happens when plaque blocks the arteries, cutting off blood flow to the heart muscle. This causes damage. Heart attacks often occur when a person is alone. Knowing exactly what to do when symptoms appear can save your life. Acting quickly when you suspect a heart attack starts is vital for survival. For older adults, being prepared is a necessary safeguard. Fast action and a clear plan are your best defense when the first symptoms begin and you realize you are by yourself. So, once you understand the danger, the next step is recognizing the signs. Because most people don't even realize they're having a heart attack until it's too late. If you've managed to notice the symptoms early, you're already ahead. Before anything else, it's worth going over the symptoms your body uses as warning signals. There are 7 signs that should make you pay attention. Let's start with the 7th, intense sweating and sudden paleness. If you suddenly break into a cold, sticky sweat that clings to your clothes and your face starts to drain of color, your body is sounding the alarm. This happens when adrenaline floods your system, tightening your blood vessels in response to the crisis. It's your heart's way of saying something is seriously wrong. Right after that comes the 6th sign, nausea and vomiting. Many people mistake this for a stomach bug, but gastric discomfort during a heart attack is surprisingly common, especially in cases where the diaphragm is involved. Cardiac ischemia can irritate the vagus nerve and cause these symptoms. Women experience this even more often, and diabetics might feel only nausea and vomiting because nerve damage can hide chest pain altogether. So, when these symptoms appear suddenly, don't shrug them off. Then there's the 5th sign, dizziness or feeling faint. This lightheadedness can come from dropping blood pressure, an irregular heartbeat, or the sheer stress on your system. Women tend to report this symptom more often, but in anyone, dizziness paired with other warning signs should make you stop and pay attention. From there, the body often moves to the 4th sign, numbness or heaviness in the arm. Most people think it's only the left arm, but the discomfort can show up in the right arm, both hands, or even around the elbows. Because of how the nerves connect the heart and arm, the brain reads the pain as if it's coming from the limb, not the chest. The 3rd sign is harder to ignore, shortness of breath. You might feel like you can't get enough air or like something is pressing down on your lungs. This happens when the heart can't pump blood effectively, causing fluid to build up. It can appear with or without chest pain, and both are equally serious. Then comes the 2nd sign, intense anxiety or a sudden sense of doom. Many survivors describe this as an overwhelming feeling that something terrible is happening inside their body. It's not just fear. It's a deep, instinctive signal caused by a surge of adrenaline. And finally, the first and most common symptom, chest pain. Not all chest pain is a heart attack, but heart attack pain is unforgettable. It sits right in the center of the chest, tight and crushing, like someone pressing down with unbearable weight. It can spread to the arm, jaw, or back, and it usually feels like it's wrapping itself around your chest. If these signs show up and you're alone, reality hits fast. Many of my patients say that in the moment, they simply knew something was wrong. Not a guess, not a fear, a certainty. They felt their bodies telling them urgently that they needed help right away. And that brings us to the most important moment, the first step you must take when you realize a heart attack is happening. Once you know something is going terribly wrong, the very next move becomes the most important decision of your life. Because in a heart attack, hesitation is dangerous. That's why the first thing you need to do is call someone who can get you to the hospital immediately. It could be your health insurance ambulance service, or even someone close to you, your spouse, your child, a neighbor, a friend. But you also need a backup plan ready in your mind. If you see that help isn't coming fast enough, if more than 15 minutes are passing, don't wait. Call an Uber, take a taxi, or knock on your neighbor's door. The goal is to get to the hospital as fast as you can. Heart tissue dies quickly without oxygen, and the sooner you reach medical care, the more of it can be saved. Now, some people think, if time matters that much, shouldn't I just drive myself? And that's where things get extremely dangerous. Driving during a heart attack is like trying to steer a car while the engine is failing. The heart is already struggling because a clot has blocked blood flow. Without oxygen, heart cells begin dying within minutes, and the damage grows with every passing moment. Think of it like a pipe that suddenly gets completely clogged. The heart pushes, but nothing passes through, and the muscle starts to suffocate. Half of heart attack deaths happen in the first hour, and one of the biggest risks during that time is a sudden drop in blood pressure or a life-threatening arrhythmia. Both can knock you unconscious without warning. Now imagine that happening while you're behind the wheel. You lose control, and you don't just put your own life in danger. Everyone around you becomes part of the accident. Even if you feel like you're okay, the physical effort of driving can push your heart into deeper trouble. Steering, pressing the pedals, shifting gears, all of it forces the heart to work harder at a moment when it's already fighting to stay alive. And if your symptoms get worse, if your chest pain tightens, if your breathing turns shallow, if dizziness hits, there's nothing you can do to react quickly enough while driving. That's why asking someone else to take you is the safest choice. Getting help is not weakness, it's survival. As you wait for the ambulance or the person who's coming to drive you, you want to make it easy for them and for emergency responders to help you. Unlock your doors, keep pets in a separate room, clear the space around you. These small steps prevent chaos the moment help arrives. It also helps to keep your medical information ready. A list of medications, allergies, and health conditions can save precious minutes. Many people store theirs in a wallet, purse, or even as a note on their phone. In an emergency, clarity saves time and time saves heart muscle. While you're waiting, focus on staying calm. Panic speeds up your heart and drains your energy. Slow, steady breathing helps keep your heart from working harder than it has to. Sit or lie down in a position that feels stable and releases pressure from your chest. Most people feel better leaning slightly back with their head supported. It keeps you balanced in case you faint. Try not to move around or do anything that strains you. Even small physical efforts force the heart to pump harder. And right now, your job is to protect it. If you have aspirin nearby and you're not allergic, chew 2 or 3 baby aspirins. Chewing helps it absorb faster, and aspirin works by keeping platelets from clumping together. That means it can slow the growth of the clot blocking your artery until doctors take over. But don't panic if you don't have aspirin at home. Hospitals always give it as part of emergency treatment. What matters most is getting there. You may have heard people say that coughing hard during a heart attack can save your life. It sounds hopeful, something simple you can do right away, but it's not true. Cough CPR spread online years ago, but real medical practice doesn't support it. By the time a heart attack has started, your heart is still beating but struggling under stress. Coughing doesn't open blocked arteries or restore blood flow. It only wastes energy that your heart needs to survive. The idea behind cough CPR is that repeated coughing could work like chest compressions and bring the heart back into rhythm. It sounds clever, but it doesn't apply to a heart attack. Rhythm isn't the problem here. The real issue is the blocked artery preventing blood from reaching the heart muscle. Coughing won't open that blockage no matter how hard you try. And while people often reach for vasodilators like Asordil or Sustrate in moments like this, that can be dangerous. Right now, the best thing you can do is stay as still, calm, and prepared as possible until trained professionals take over. Because once blood stops reaching the heart, every step you take should be toward one goal: staying alive long enough to reach treatment. Aspirin can help because it keeps platelets from clumping and slows the growth of the clot. Vasodilators don't do that. They don't lower the risk of death, and in some situations, they can make things much worse. If you've taken medications for erectile dysfunction like Tadalafil, Cialis, or Viagra, the combination with a vasodilator can drop your blood pressure so drastically that it becomes life-threatening. And in cases of right ventricular infarction, a vasodilator can outright collapse the person's circulation. It's a reminder that emergencies are not the time to experiment or follow trends, but while coughing won't help you during a heart attack, things change if you're the one helping someone else and that person has already lost consciousness. If you find them unresponsive, not breathing, and not moving, it may mean they suffered a massive heart attack. These are the most aggressive, deadly types, where a major artery becomes suddenly and completely blocked. When that happens, cardiac arrest can follow in minutes. Around 15% of heart attacks end in sudden death, often because a violent arrhythmia like ventricular fibrillation interrupts the heart's ability to pump. But if you arrive at the exact moment it starts, you still have a chance to intervene. And the first thing you must do is call someone. But you can't wait passively while they're on their way. You start chest compressions immediately. Strong, steady pushes at around 100 to 120 per minute, right in the center of the chest. You keep going without stopping because those compressions become the person's heartbeat until professionals take over. It's physically demanding, but every push keeps a small stream of blood moving, and that small stream keeps the brain alive long enough for a chance at survival. And all of this circles back to the single factor that decides how someone will recover. The faster you recognize the symptoms and seek help, the more heart muscle can be saved. Doctors often refer to this gap between the first symptom and the moment they open the blocked artery as the golden window. The shorter that window, the better the outcome. When doctors can restore blood flow quickly, survival rates rise sharply. The risk of major complications like heart failure drops. Hospital stays shorten, and patients return to their normal lives more quickly. That's why ignoring symptoms or waiting to see if it gets better is so dangerous. Your heart doesn't wait. The damage doesn't pause. Every minute counts. And once you've made it to the hospital, remember this more than anything. You are a priority. A heart attack isn't something you whisper about or politely wait your turn for. You don't sit back and hope someone notices you're in pain. You speak up. You tell them what's happening. Because every minute that passes is another piece of heart muscle struggling for oxygen. This is your life on the line, and you deserve immediate care. And that urgency doesn't end at the reception desk. When you're in the examination room, you have to continue protecting yourself. If you feel the doctor isn't taking your symptoms seriously, you have every right to insist on the basics. At the very least, you need an ECG and blood tests for cardiac enzymes. These are standard for anyone with suspected heart attack symptoms. If someone tries to send you home without them, you must advocate for your own safety. Your body is telling you something serious is happening. Don't let anyone silence that signal. Once the tests are done, the next steps depend on what the results show. If the ECG reveals a supraventricular heart attack, one of the most critical types, the treatment becomes urgent and very specific. In this situation, doctors may use thrombolytic medication. It's given through an IV, and its job is to break down the clot that's blocking the artery. But in many cases, the better option is catheterization. This is where doctors insert a catheter into the artery, find the blockage, open it, and place a stent to keep blood flowing freely again. And while knowing what happens during treatment is important, it's just as important to understand who is most at risk in the first place. Heart attacks don't strike randomly. There are patterns, and being aware of them gives you a chance to take control before trouble begins. Men over 45 and women over 55 carry a higher risk because age naturally stiffens arteries and changes how the heart handles stress. Smoking increases the workload on the heart and damages blood vessels over time. High blood pressure forces the heart to pump harder against resistance. High cholesterol, especially LDL, slowly builds plaque inside artery walls. And diabetes quietly damages nerves and blood vessels, reducing the body's ability to respond to stress or inflammation. Obesity adds strain to the heart, and a sedentary lifestyle weakens the body's ability to maintain healthy blood flow. Constant stress floods the body with hormones that keep the heart in a state of tension. And family history can load the genetic dice, making some people more vulnerable even when they make good lifestyle choices. Even drug use, cocaine in particular, can trigger immediate coronary spasms that cut off blood flow. And still, there are cases where none of these risks are present, and yet someone suffers a heart attack. The body is complex, and sometimes silent vulnerabilities exist where we least expect them. But knowing the risks is only the first part. The second, more empowering part is understanding how much control you actually have. Heart attacks can often be prevented, not through extreme changes, but through consistent, thoughtful habits that support your heart every day. It begins with food, because what you put into your body becomes the fuel your heart relies on. A balanced diet filled with fruits, vegetables, whole grains, healthy fats, and lean proteins gives the heart the nutrients it needs to stay strong. Cutting back on trans fats, processed foods, and excess sugar reduces the buildup of plaque that narrows arteries. And after food comes movement. Exercise does more than strengthen muscles. It strengthens the entire cardiovascular system. It improves circulation, helps maintain a healthy weight, lowers stress levels, and keeps the heart resilient. You don't need to become a marathon runner. You only need consistency. 75 minutes a week of intense exercise like running, or 150 minutes of moderate activity like walking, swimming, or cycling makes a profound difference over time. Your heart remembers every step you take for it. Alongside exercise, maintaining a moderate weight eases the burden on the heart. When the body carries excessive weight, the heart works harder every day, even at rest. Losing even a modest amount of weight can improve cholesterol, blood pressure, and blood sugar all at once. And while weight is one factor, smoking is another major one. Quitting smoking is one of the most powerful decisions you can make. Once you stop, the body begins repairing itself almost immediately. Blood vessels relax, heart rate stabilizes, circulation improves. It's a gift you give yourself that pays back for the rest of your life. Sleep plays a bigger role than most people realize. Poor sleep throws off hormones, increases stress, and contributes to weight gain and inflammation. Getting 7 to 9 hours of restful sleep helps the heart recover from daily stress. Speaking of stress, learning to manage it is a crucial part of prevention. Chronic stress keeps the heart tense and disrupts blood pressure. Simple practices like deep breathing, meditation, prayer, quiet reflection, or even hobbies can calm the nervous system and ease the strain on your heart. And if you already have conditions like high blood pressure, diabetes, or high cholesterol, treating them is non-negotiable. These conditions chip away at your heart health silently. Regular medication, routine follow-ups, and lifestyle changes can protect you more than you might imagine. They don't just reduce risk, they often reverse early damage, and that's why regular checkups matter. Many problems are invisible at first. A yearly exam can catch them before they turn into emergencies. And now that you've walked through all of this, take a moment, breathe, let it settle in. Because the information you just learned isn't just medical advice. It's something that could save a life. Maybe yours. Maybe someone close to you. Heart attacks don't always give warnings. Sometimes the first symptom is the only symptom. Recognizing the early signs and acting quickly is what turns a life-threatening moment into a story of survival. When you understand your body, when you trust the signals it sends, when you protect your heart with daily choices, you put yourself in the strongest position possible. You take back control. And more importantly, you give yourself a chance to live with confidence instead of fear. Because the real victory in heart health isn't just surviving an emergency, it's preventing it. It's giving your heart the care, respect, and attention it has given you your whole life. And that's what this entire message comes down to: awareness, action, and ownership of your own health. Your heart works for you every second of every day. It deserves the same loyalty in return. And when you give it that care through your choices, your discipline, and your courage, you create a future where strength becomes your story, not crisis. If this message helped you see your health differently, subscribe to the channel so you don't miss what comes next. Watch the next video to keep building that strength step by step, and comment below. What's one change you're committing to starting today?